Alright, so the first part we're going to do is just quick observations, and the first one we're going to do is going to look at her stance from the front, and I'm just going to look to make sure her ASISs are in the same horizontal plane, and then for the next one we're going to look at her from the side, and we're going to look for lumbar lordosis. Make note that it's either like exaggerated, absent, or normal. And then last, we're going to look at her from the back and make note where her PSISs are and make sure that those are in the same horizontal plane. And so next, we're going to move to the special tests. And the first one we're going to do is true LLD. And for this one, I'm going to have my patient sitting supine and lay down. And we're going to measure from the ASIS to the medial malleolus. Let's see. And for this one, it's positive, and then you check the other side. And so it's positive if there's a greater than 1/8 difference between the two, and this is caused by an anatomical or structural change in the leg. And it's important to note that the measurements of these can be affected by obesity or even atrophy, so it's important to make sure to position your patient properly. So the next one we're going to do is true LLD part 2, and for this one I'm going to have my patient sitting supine again, but with her knees bent to 90, and I'm just going to observe to see which leg is higher and if there is a difference, and if the if one knee is higher, that would indicate that the tibia on that extremity is longer, but if the knee protrudes anteriorly, that would indicate that the femur on that extremity is longer. So last one we're going to do is apparent LLD, and it's important to establish that there's no true LLD first before doing this one. And so for apparent LLD, I'm going to have my patient supine again and her legs extended. And for this one, we're going to measure from the umbilicus to the medial malleolus. And apparent LLD can be caused from pelvic obliquity or from adduction or flexion deformity of the hip as well, and pelvic obliquity would also be shown if the ASIS or PSIS was uneven when they were standing.